we get information in WHO? We get information in numbers. This many people died or this many people had been infected. We don't see the numbers. We see the individuals behind the numbers. The mother of somebody, the father of somebody, the daughter of somebody, and the son of somebody, or the grandfather of someone.
Those are impactful words from the World Health Organization Director General Dr. Tedros Ghebreyesus. These words are the inspiration behind this initiative by SABC News to bring home the reality of the impact and effect on the lives of people caused by COVID-19. This feature, The Lives They Lived, aims to remember and honor the people who have died from this pandemic. It aims to offer some comfort to the families who have been left behind in the devastating wake of COVID-19 deaths. According to the World Health Organization, as of today, June 28th, more than 494,000 people have died from COVID-19 related cause deaths globally. In South Africa, 2,413 have lost their lives so far. Our reporter Jayed-Leigh Paulse spent some time with the family of a Durban man who lost his 29-day battle with COVID-19. They were shocked when he passed away, as he tested negative just a week before he died. Anton Harman spent a month on a ventilator in hospital fighting for his life. Watch.
My name is Tracy Harman. I was married to Anton John Harman. We were married 28 years. We were married on the 3rd of March. And it was just before the coronavirus, and we went into lockdown. We have a daughter, Etia. She's 22. She's such a blessing and the most amazing part of our lives. The three of us have done things always together. We've never been apart. My husband was very concerned about catching the coronavirus. When we went into lockdown, we would watch the TV. We would obey all the rules. I'm an essential worker, and he would come and fetch me, and we would have our masks on. I would sit in the back of the car. We took all the precautions. He was the only one that went shopping. And people ask you, where did he get it? And I truly don't know. And then got the virus in April. Him and my daughter were tested, and he came back positive and she was negative. And then I was tested 2 days after that, and I came back positive. And then Department of Health came through to our house because I was an essential worker, and they tested her, and her result came back positive then. It was completely devastating. My daughter, my husband had high temperatures, were coughing, had body aches. I had very mild symptoms. I didn't even have a temperature. And we thought everybody would be fine. We isolated together. But as the days grew on, he just got weaker and weaker. And I remember the day before he went into hospital, his temperature was sitting at 39. It just wouldn't break. He went up to the hospital and they admitted him. And it was the last time that I spoke to him. He said he was going into a hike. And later on that afternoon, I got a phone call from the doctor to say they'd placed him on a vent. We weren't allowed to see him. The doctor was amazing. Thank you, Dr. Khan. You phoned me every day and updated me. You answered every single question I had. We would watch the news, we would watch CNN for any signs of a cure, treatment. We tried everything, we really did. He was on the vent for 29 days. Our GP said, no, he's such a fighter, he'll be fine, he'll be strong, he'll come off the vent. And it was the Thursday night, the 21st of May. I would always say to him, love, at 7 o'clock the nurses are going to hand over, you're going to get a new lot of staff and they're going to take care of you. And 7:30 they phoned to say they were busy resuscitating him. Even the doctor phoned about 10 minutes later to say he didn't understand what had happened because he'd had such a good day. They'd bathed him and shaved him. And then they phoned at 8:15 to say he'd gone. You know, people don't realize you cannot even begin to think if you have COVID that you will die. I didn't think that would happen to us. I'm going back to work on the 1st of July. I'm so scared. I have to prepare my daughter now and get my will in order and say, should something happen to me, you need to know what to do. It is tearing families apart. We did everything together. We used to shop together. And yesterday I had to shop and go and get food. I hate going to the shops because all I do is cry. The man that I loved, my soulmate, is not with me anymore. And yesterday we were at the shops and there was a woman there who had a mask on, and she must have had a 3 or 4 year old little girl without a mask. Come on. You know, is your child worth catching this virus and dying? Where are your priorities? The world needs to wake up. They really do. We are not flattening the curve in South Africa. It's just getting worse. I've got colleagues who've got COVID. I've got family who's got COVID. And everybody is so scared. And everybody is an internet doctor. You know, maybe if this was done, he would have been alive, or if that was done, but it's not. You know, until you get the virus, or you lose somebody, will you understand? I just want people to know that this is not the flu. This is so much more. It's destroying lives.
His passing has really affected the family in so many ways. It honestly feels like we're living in a horror movie or a horrible nightmare and we can't wake up. All we want to do is just to wake up and everything be back to normal. But this new normal is here to stay. My mother has really been struggling, and so have I. My father and I were really, really close. So close, in fact, that I saw him as a best friend. I had the best dad in the world, and it hurts so much. I miss you so much, Daddy. I miss you so much.
Look, I hear you. It is difficult to watch that. But this is the reality, the pain, the hurt that COVID-19 brings. But I guess there's a measure of solace. We have good men and women on the front line fighting against this disease. Let me get a perspective now. We're joined via Zoom by Dr Kanyiso Tapula, a Johannesburg medical practitioner specializing in clinical research, internal medicine. Doctor, thank you very much indeed for your time.
Thank you so much for having me.
I'm not sure if you heard that insert that we just played a short while ago, the melancholy apparent, the hurt apparent, pain Take us behind the scenes. Push back the curtain for us, if you will. What goes into taking care of a person who has contracted COVID-19 and needs hospital care?
So from the time a patient comes into a hospital environment, there's a lot of fear and there's lots of anxiety from the staff, the nursing staff, the doctors, the porters. And so one has to really be wearing PPE, personal protective equipment at all times. And I think it's come to the point now with all patients that we're seeing, whether it's a sprained ankle or one who's got respiratory needs to be treated as though they have a coronavirus infection. Yeah. So it's a very tense environment, lots of anxiety for the staff, and there's lots of anxiety for the patients themselves and for the caregivers.
Right.
So, I mean, as mentioned in the clip, generally speaking, patients who are suspected of having coronavirus are treated in what's called PUI wards. So PUI stands for patient under investigation. So generally patients who we suspect to have COVID are seen in those wards until we have definitive test results. Yeah. It becomes very difficult, and it's currently very difficult because there's quite a large backlog in terms of testing. So depending on whether you're in the private or public sector, it can take anything from 1 to about 8 days. Yeah. Which obviously would delay optimal management of patients. But I think also there's a lot of, as I said earlier on, there's anxiety from the patient side because they don't know what to expect. And generally speaking, patients who are suspected of having COVID are not allowed to visit us. So they really walk through this on their own. So family members, friends cannot come see them. So once you're admitted and suspected of having coronavirus, you really are just with the hospital staff.
It is no doubt a tough job, and you and your colleagues are among the best of us. And where there is heroism, there will always be hope. And it seems that all of human ingenuity has been brought to bear to defeat COVID-19. It's just a matter of time, hopefully, that sooner rather than later. Dr. Kanyiso Tapula, a Johannesburg medical practitioner specializing in clinical research and internal medicine, we thank you. Be well. God bless.
Thank you so much.
All right, we're going to take a quick break. I'll have more next.